Good morning, everyone. Good morning, everyone. A warm welcome to all the dignitaries, eminent speaker, virtual participants, and dear students to this national webinar on the topic Transforming Healthcare, Partnering with Pharmacist. Myself, P. Lakshmi, working as Assistant Professor in Sri Padmavati School of Pharmacy, welcome you all for this virtual webinar. Sri Padmavati School of Pharmacy has a tradition of organizing various seminars, workshops at national and international level on campus very oftenly. But because of pandemic situation, we couldn't organize this on campus. Hence, we are organizing as a live webinar. Now, let me invite dignitaries for today's program. First, I would like to invite coordinator of today's program, Dr. Shanmugam sir, for today's session. Good morning, sir. Welcome you, sir. Now, I would like to invite Organizing Secretary, Sri S. Dhananjay sir, for today's session. Good morning, sir. Welcome you, sir. It's my privilege to invite convener of today's program, President of IPA, Tirupati branch, Principal of Sri Padmavati School of Pharmacy, Dr. D. Ranganayakulu sir, for today's session. Good morning, sir. Welcome, sir. It's my great honor to invite Chief Guest of today's program, Dr. S. Sriram Garu, for today's session. Good morning, sir. Welcome you, sir. We are very glad to have you here today, sir. Thank you, sir. The best wishes of our chairperson, ma'am, Srimati P. Sulochana, madam, and our director, P. Praneeth, sir. We thank them for sending their best wishes for successful completion of today's program. Traditionally and as usually, let us start today's program with invocation song.
सरस्वती नमस्तुभ्यं वरदे कामरूपिणी विद्यारम्भं करिष्यामि सिद्धिर्भवतु मे सदा पद्मपत्रविशालाक्षी पद्मकेसरवर्णिनी नित्यं पद्मालयां देवी सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा.
Now I request P. Sai Sunil to give glimpses of our college.
You have to unmute.
Myself, P. Sai Sunil, Assistant Professor, Department of Pharmacy Practice, Sri Padmavati School of Pharmacy. Before starting today's session, let me present glimpses of Sri Padmavati School of Pharmacy in few seconds. Sri Padmavati School of Pharmacy was established in 1997 under aegis of Sri Padmavati Educational Institutions, founded by Sri late P. Mohan Rao Garu and currently headed by Srimati P. Sulochana Madam Garu and Sri P. Praneeth Sir. The courses offered by Sri Padmavati School of Pharmacy are D.Pharm, M.Pharm, PharmD, PB, and Research Center. Present now, post-graduation courses at Sri Padmavati School of Pharmacy are Pharmacology, Pharmaceutics, Pharmaceutical Analysis, Pharmacy Practice, PharmD, and Post-Baccalaureate, and R&D Center from 2013. Coming to the achievements in last 3 years, our college have received campus preparedness award in the year 2015, and our students got 8 pratibha awards and 1 university gold medal. While coming to the research activities, 160 publications and 84 oral and poster presentations have been published in conferences and various webinars. Then at present 8 phd awardees are there in our college. Then, while coming to the entrance exams, GPAT, it's an esteemed exam. While collecting at the statistics, 8 students in 2019, 12 students in 2018, and 11 students in 2017 have been qualified from our college. Then, as well as NIPER, 9 students in 2018, 7 students in 2017, 11 students in 2016 have been qualified from our college. Besides academic and research activities, our college also organizes National Pharmacy Week celebration in association with all local pharmacy colleges and office bearers of Tirupati IPA. Then we'll celebrate Old Pharmacist Day. It is recent 2019 celebration. We had an habit of organizing debates, elocutions, essay writing competitions at SPSP. Then we'll have a rally and awareness campaigns on most important health days. This is awareness rally conducted by SPSP on Old Pharmacist Day 2019. Presently in 2020 also, we had conducted a webinar transforming healthcare in 2020 Old Pharmacist Day. While coming to the research scholars, presently now in SPSP are 11 members are then at SPSP. Then we had a habit of organizing extracurricular activities, dance and music club, sports and games club, career guidance cell, placement cell, grievance cell, anti-ragging cell, and we'll organize workshops and conferences and now webinars also. Then we'll invite honorary speakers and eminent personalities for annual day celebrations every year. This is Pharma Week celebrations. Here we can see President PCI President Dr. B. Suresh Garu. Then we had a habit of organizing social welfare activities on important health days like World Diabetes Day, AIDS Day, etc. Every year we had a habit of meeting alumni get together. Then, while coming to the pharmacy practice department, established in 2011 with a mission of providing clinical education that uses evidence-based approaches to optimize the practice of pharmacy, deliver quality patient care, and provide related service. The department is equipped with computers, provided with internet connections, smart classrooms, referred journals, and we had a library in the department. Sri Padmavati School of Pharmacy has MOU with Sri Venkateshwara Ram Narayana Ruya Government General Hospital, Tirupati, for conducting clinical practical sessions for pharmacy students. This is our department, pharmacy practice department in hospital. This is Drug Information Center, a division of pharmacy practice in the hospital premises at Ruya. It is for prompt and detailed responses to pharmacotherapy related queries. Then these are internship students who are participating in department activities, ward round participation and drug chart review. Then adverse drug reaction and DDI monitoring. Intern students who are participating in patient counseling, they will make aware the rural people who are not able to diagnose their disease and lifestyle modifications, so that quality of life of the patient will be increased through them. Then this is case presentation and journal presentation by PharmD fifth year students. Some of the databases used for drug related information: Micromedic software, drugs at the rate FDA, drug interaction checker, PAM checker. And these are the awareness campaigns on most important health days. And many PharmD graduates and pharmacy practice graduates from our college alumni have been placed in Basava Tarakam Indo-American Cancer Hospital and Research Institute as duty doctors, Narayanadri Hospital, Seven Hills Hospitals, and many alumni had been placed in multinational companies like Bioclinica, Cognizant, Equio as pharmacovigilance associates. Thank you very much, everyone.
Thank you, Mr. Charan. Now I request convener of today's program, Dr. D. Ranganaikulu sir, to present open remarks for today's session.
Yeah, thank you, Lakshmi. Is it audible?
Yes, sir.
Lakshmi, is it audible?
Yes, sir. Audible, sir.
Respected, okay, thank you, ma'am. Respected Chief Patron, Madam Sulochana Garu, Padmavati Group of Institutions, Patron P. Pranish sir, Director of the Padmavati Education Institutions, Organizing Secretary, Dr. Shanmugam, and today is the most important person, our chief guest and honorable speaker, Dr. S. Sriram sir, Professor and Head of the Department of Pharmacy Practice, Sri Ramakrishna Institute of Pharmaceutical Sciences, Coimbatore, and coordinators, Mr. Dhananjaya, Lakshmi, Sunil, all the Pharmacy Practice Department, all delegates who are registered for this program, and my dear students. Very good morning and welcome to you all on this occasion. The one-day webinar program, as Mr. Sunil is very much narrated, and Lakshmi also has given the reason behind to conduct this kind of webinar program. Of course, everybody knows this in a pandemic situation. We don't want to waste our time, and it's the time where we can have the kind of interaction with many notable personalities. Physically, it is not possible to conduct this kind of a continuous program, to have the different virtual intellectual people on the same platform and within short of time. And of course, poet has given some kind of blessings for us to have this kind of interactions and continuous process. Right from March, we are conducting this kind of program with a kind of collaboration of Indo-African collaborations, 3 days seminar program, and USA collaboration program. But at us now, 25th, recently we conducted one more program in view of this International Pharmacist Day celebration, that is a transmission of global health. The same concept, again, we are conducting this kind of a webinar program on the title of Transmission of Healthcare Partnering with a Pharmacist. That's quite a little different. That is in general that given, but here today our honorable speaker is going to explain in depth of this role of pharmacist, what is the vital role of the pharmacist role in the healthcare system. Because no doubt it's a very unmoored profession, pharmacy profession, to entertain this healthcare safety guard system. In this, definitely this the virtual talk of Professor Sriram sir is going to be ignite all the young birds of pharmacists and teacher pharmacists and all the pharmacists who are related with the healthcare system. Definitely, it will inspire and it will make an involvement within a committed role in the take caring of the healthcare system. This webinar program and webinar program is going to be meet out the expectation of the global demand and global expectation regarding this pharmaceutical healthcare system. So in this regard, on behalf of my management, on behalf of my pharmacy practice department, and all my fellow other departments like pharmacology and pharmacy practice, on behalf of all my students and delegates, I request Professor S. Sriram sir to lead the section to ignite the minds. Because as you know very well, most of people are very associated with me. They know very well, we are all fellow, Dr. Sriram sir. We know almost many colleges we visited during the pharmacy council of inspection. We noted some kind of mindsets in the learning birds with the learning birds of pharmacists, that especially pharmacy section. There are some ambiguities thinking in a different ways that is doctors or something else. Because in this same, sir is going to be clear of that all clouds within a prospects and prosperity and role and responsibility of the clinical pharmacist as well as the pharmacist role and how to meet out the global demands by transmission of the healthcare system. Thank you very much, sir. I invite once again on behalf of the management and staff. Over to studio.
Thank you, sir. Thank you very much for the nice introduction.
Lakshmi?
Am I audible, sir?
Yes, sir.
Yeah, very much, sir.
Thank you very much, sir.
Yeah, is my screen visible?
Yeah, very
Is my
visible,
screen?
sir.
Visible. Okay, fine. So at the outset, I'd like to thank you all, especially the management and the principal, sir, for inviting me to deliver a talk in the webinar. And it's a nice opportunity for me to interact with you all during this pandemic situation. See, the topic given to me.
Sir, excuse me, sir. Sir, there is one citation PPT about Honorable Speaker, sir. Excuse me, sir.
Yes.
Thank you, sir.
Yeah.
Thank you,
Thank you,
sir.
sir. Excuse me, sir.
Let us move on to today's scientific session. Before that, I request Mr. Sai Sunil to give brief citation of our today's honorable speaker.
Thank you, ma'am. Sir, is citation PPT visible and audible, sir?
No, actually, I have shared my screen. Should I come out?
Sir. Sir, okay, sir. Yes, sir.
Echoes the sound.
Good morning, everyone. I would like to introduce our today's speaker to the virtual audience. It's my privilege to introduce Dr. S. Sriram, sir, M.Pharm PhD, Professor and Head, Department of Pharmacy Practice, Sri Ramakrishna Institute of Medical Sciences, Coimbatore. Academic qualifications. Sir did his bachelor degree from Institute of Pharmaceutical Technology, Annamalai University in the year 1990. And Sir did his master's degree in pharmacology specialization, JSS College of Pharmacy, Ooty in the year 1993 to 1995. And Sir completed his doctoral program in the evaluation of adverse drug reaction and drug interaction monitoring. While coming to the professional positions held by Sir, Sir worked with Glaxo India Limited at Delhi and Haryana for 2 years, and then Sir served as area manager at Cadila for 1 year, and Sir is presently heading department head as Sri Ramakrishna Institute of Paramedical Sciences, Coimbatore. Then Sir is chief editor for Pharmacy Practice newsletter from Sri Ramakrishna Institute of Paramedical Sciences, Coimbatore, and Sir has been member of advisory board member and reviewer in Indian and international journals. Then coming to the achievements, Sir has more than 25 years of experience in teaching. While coming to the publications, 95 in national and international journals, and Sir has received prestigious Best Teacher Award from Tamil Nadu Dr. MGR University, received from the Governor of Tamil Nadu, and Sir has been in the duty of Inspector, Pharmacy Council of India, and Board of Studies member in various universities. Sir has received gold medal in M Pharmacy, and Sir was awarded with Best Outgoing Student. Then outstanding pharmacy faculty of the year 2017 from IPA Anantapura branch. Then Sir was the member of Secretary of Bioethics Unit of International Network of UNESCO Chair in Bioethics, and Sir has been nominated as Associate Secretary, Central Executive Council, Indian Pharmaceutical Association Education Division from 2018 to 2020. Sir has been lifetime member for APTI, IHPA, IPA, IPGA, and ISPOR. Thank you very much, sir, for accepting our invitation. Thank you, sir.
Thank you. Thank you very much for the nice introduction.
Thank you, sir.
Sir, please share your slides, sir.
Yes, yes. Just tell me once it is visible. Is it visible? Is the slide visible? Is the slide visible?
Sir, they are visible, sir, now. Yeah,
Is
your
the slide
screen
visible?
has been shared, sir. You just open the PPT and keep the full screen, sir.
Yeah, I've kept it.
Yes, sir.
You can see the first screen, first slide.
Yes, sir. They are visible, sir, now.
Okay. Okay. So at the outset,
Yes,
I'd
sir.
like to thank.
Yes, sir. Yes, sir.
Thank you very much for the nice introduction. I'd like to introduce myself as a pharmacist and a human being, first of all, rather than giving all the credits, all other credits, because being human is, again, a big thing nowadays, especially in this pandemic situation. So I also thank the organizers, the principal, Dr. Ranganayaklu sir, is a very good friend of mine and is always supportive, and the management, Sri Padmavati Group of Institution Management. I thank each and every one for this opportunity to interact with you. So the topic given to me here is transforming healthcare, partnering with pharmacists. I always start with a hearty welcome. So all of you know that heart is one organ in the body which gives whatever it receives. So we pharmacists also need to be like that. Whatever we have received, either in the terms of knowledge or in terms of the service. So whatever we receive, we need to give again to the public for the patient care. Just a small thought about if your heart speaks, what it can speak. The heart can say that I am the first organ to start functioning in the fetus. It will say that I pump around 1 million barrels of blood. It also can say that I beat around 300 crore times in your lifetime. I can throw the blood up to 30 feet, and within 20 seconds I circulate all over the body. And if you keep my arteries, veins, capillaries through which I am traveling, and it is around 60,000 miles long, and I pump around 5 liters of blood each minute. It's not only heart. You take any organ in the body, say for example liver. Liver can proudly say that I am the only organ in the body who can completely regenerate, and I am the second biggest organ next to skin, and I store glycogen, fats, vitamins. I perform more than 500 different functions. Each and every organ has its own credits. If you say lungs, the lungs can say that each lung, I've got two lungs, one is right and left. The right is bigger than the left, and we've got 3 lobes on the right and 2 lobes on the left, and each lung contains around 300 millions of alveoli, and the surface area is roughly same as that of a tennis court. So each and every organ in the body, say brain, it says that I am the fattest organ in the human body, and I make around 2% of the body weight but requires 20% of body's oxygen. I triple in size during the first year of my life and contains 86 billion nerve cells and the blood vessels around 1 lakh miles in length. And I weigh around approximately 3.3 pounds or 1.5 kgs. So each and every organ can talk something good about themselves. You take kidney, it says that I am the hardest working organ in the body, and I filter around 180 liters per day. And it will also say that around 10 to 12 centimeters long. I'm 150 grams weighing. I release hormones which regulate the blood pressure. 25% of the blood from the heart goes for me only, that is to the kidney, right? So a lot of organs, they can start talking about themselves proudly. And each and every organelle inside the body, it keeps talking among themselves. Mitochondria says, I am the powerhouse of the cell, right? So nucleus says, everyone do whatever I say. So I am controlling the cell. So each and every organ, each and every part keeps talking. The cell says that when to release a particular hormone during the circadian rhythm in the body, that is during the body clock, when to release what hormone. Everything is well fixed and the body clock is functioning nicely inside. So inside all the organs are doing its function very well. But outside, whether we are taking care of those organs or not. When we don't take care of these organs, we end up in disease. When all the organs are functioning normally, we say you are having normal physiology. And whenever there is alteration in the normal function of the body, we call it as a disease. What is a disease? It is nothing but altered physiology. Altered physiology is the disease. The Global Burden of Disease Study, GBD study, which is one of the largest study in the world, right? The Global Burden Disease Study, the latest report is on 2017. It says that most comprehensive study sees there are a lot of health challenges in the world. It also says that when compared to 100 different types of countries were taken into consideration, and they here I have specifically mentioned throughout the globe, as well as comparison with India. So in India, if you see in 1990, the maternal and neonatal diseases were more, ranking number 1, and respiratory infections number 2. Whereas now in 2017, the latest report says that cardiovascular diseases are ranking number 1, followed by maternal, neonatal, and then respiratory diseases. There are a lot of crises in the global healthcare. The high medical risk. When the age advances, the patients have a lot of comorbid conditions, and for which they have to take n number of drugs. And when the number of drugs increases, the risk of this medicine is also increasing. A lot of medication errors are reported. It is not only from the prescription, it is also from the dispensing, from the administration errors. A lot of different category of errors are being reported in the literatures. And the healthcare cost is one of the major problem nowadays, right? Whenever they get admitted, if they don't have the insurance, the healthcare cost increases rampantly. And lack of patient access to healthcare or health disease or health data. For example, if the patient goes to a hospital and when he comes out of it, all the reports, everything is nowadays being retained at the hospital side. So he doesn't have much data about his own health. Whereas in some countries like UK, they have got a specific number, NHS number, National Health Service number, and this number is common throughout wherever he goes in the country, and any hospital, they can retrieve the data of this patient. So shortage of infrastructure facilities. So lots and lots of problems are there throughout the globe. So once you wanted to transform the healthcare, first and foremost thing is you need to have the healthcare professionals, right? The healthcare professionals, the number of healthcare professionals need to be more and sufficient. We should have health infrastructure facilities, and we also should have the reduced healthcare cost. So the development of health information is the backbone, and we need to do the service with quality. The quality of care should be very much essential, and everything, whatever we do, should be patient-centric. This is one reason why the disease occurs. If you see the literature, a lot of literature says that disease is because of stress. Most of the diseases during this pandemic situation, when people are informed about corona, people are stressed, right? And because of stress, the immunity level goes down. Lots of reports are there, few reports I have focused here. The immunity level goes down because of stress. Stress-induced diabetes, stress-induced hypertension, stress-induced ulcer. Lot of diseases are coming to the body and changes the chemical components in the body because of stress. If you see this picture, this particular child doesn't have any stress. The whole world for this particular child is the small chocolate cake. I remember this lady now, Louis Hay. She's identified with breast cancer in the age of 55, whereas even though doctors said that she will be alive only for another 2 to 3 months, she felt happy and she started giving whatever she has got, either it is money, clothes, the whatever informations she want to pass it on happily to everyone. She did it, and she lived till 90 years. It's again a medical miracle. People doesn't know how she lived with 90 years when she was identified with a end-stage cancer, breast cancer, in 55 years. And she has written 23 books, and in one of her books she has told very clearly that all your expressions, all your thinking, all your emotions are being controlled, and all this directly proportional to the chemicals which are secreted in the body. When you are anger, you are getting this adrenaline, noradrenaline more in the body, right? When you are happy, serotonin, 5-hydroxytryptamine is secreted more in the body. So all your emotions are deciding the disease in your body. So be happy so that get rid of the diseases. Don't stress yourself. When I say happiness, happiness is a choice. Everyone happiness is different. For some people, happiness is listening music. For some people, happiness is watching movie, of course, with a good partner. For some people, the diving in the pool and having a good bath in the morning is happiness. For some people, going along with their friends for a long ride in the bike, it gives happiness. For some people, working out in the gym in the morning itself is happiness. For some people, playing cricket is happiness. Dancing gives happiness to few. And counting money again and again, this is again happiness to few people. Reading good books gives you happiness. Shopping, when the credit card is given to them, you have to check the female. Shopping with happiness. Photo shoot gives happiness to some people. Chatting with friends in mobile, again happiness for few people. Doing some group activity gives happiness. Traveling with friends gives happiness. So happiness differs with people, right? For some people, getting jewels or ornaments or gold gives them happiness. But what is the real happiness, you know? The real happiness is helping others without expecting anything from them. That is the real happiness. And we pharmacists are blessed with this happiness, because when we become pharmacists, we are at the verge of, we are at the end of helping others. Whether you are a community pharmacist or a clinical pharmacist or working in the industry or R&D, wherever you are in clinical research, wherever you are, you be proud that you are a pharmacist, because you are the helping end. You are going to help the public. You are going to help the healthcare and also the patient care. A very good information for all of you that in abroad countries, the pharmacy managers are the highest paid jobs in 2019. And it is said that these pharmacists are rated very high for their ethical standards being practiced. Continuously, pharmacists are ranking within the first 5. This is a survey called as Gallup poll, which is conducted in the United States. So the pharmacists throughout the globe, they are the third largest group of healthcare professionals. Along with medicine and nurses, they are also there as the third largest group of healthcare professionals. Over 40 years, we have changed from dispensing to pharmaceutical care. The role has changed a lot. It is not only just taking and giving the medicine. We have changed the role into medical counselors, educators, advocates, right? Drug-related problems are being identified by the pharmacist, and throughout the world, they save a lot of cost. The patient hospital cost is being saved. If you see here, the decrease in expenses resulting from pharmaceutical care implementation can generate savings of nearly 5,377 US dollars per adverse event and avoided. And if you avoid one adverse event, it saves around 5,377 US dollars. And if you see per pharmacist per year, it is said that $4,21,810 are being saved if they are into clinical practice. What about India? In India, we rank the third largest producer of medicine in the world and second largest in the work field, and around 80% of antiretroviral drugs throughout the world being used are from India, and more than 40% of the drugs used in the US is from India, and we are the one who are having maximum number of US FDA firms. Around 584 plants are there, US FDA firms are there in India, and every third pill taken in the world is from India, and 1 in 2 vaccines used in the world is from India. And especially in COVID situations, if you see the vaccine, whoever brings the vaccine first, but we are the people who have the capability, who have the infrastructure to manufacture these vaccines in bulk. And more than 20,000 pharmaceutical firms and making India as a pharma hub of the world. We are proud that we are Indian pharmacists. A lot of strength are there with Indian pharmacists, right? If you see the pharmaceutical companies, we have the maximum US FDA approved facilities and largest number of drug master files. What is this drug master file? Whenever a new drug is coming, we wanted to submit all the informations, right? This information submitted is a drug master file, and this drug master file submitted by India is more when compared to other countries in the world. And they've got highly trained manpower, and they've got strong IT skills as well as the English communication speaking skills. The world's largest healthcare program, Ayushman Bharat, is launched in India, and it benefited almost 10 lakh people already. And Pradhan Mantri's Jana Shudhi Kendras, the generic medications are being used by the people for the poor. It is being budgeted, and lots of informations and lots of good things are happening in the country for the medical field or pharma field. If you see, when compared to other countries, the cost of medication is less in India. This is because the India's rejection of secondary patent. What do you mean by patent? Whenever a drug is released, the patency period is there. Up to around 20 years, the patency period is there. Right? Once the patency period is over, the drug comes off patent. Right? And during the time of patent, during the end of the patency period, some of the companies, they change the molecule, they change few slight changes in the molecule, and they try to go for secondary patent. And that secondary patent is not permitted in India, and that is the reason most of the anti-cancer drugs are available in affordable prices in India when compared to other countries. Here I have given few good examples. For example, Gleevec, right? It is imatinib, right? Anti-cancer drug. It costs only 11,000 rupees in India, whereas in other countries it is 1.6 lakhs. Similarly, adalimumab, it is again 85,000 in USA, whereas only 13,000 rupees in India. And another drug, it is again for the respiratory problems, that is Spiriva, which is 19,100 rupees in USA, which costs only 250 rupees in India. It is all possible. The low cost medicine with good quality medicine is all possible in India because of rejection of the secondary patent. At the same time, if you see the Human Development Index, where India stands. What is this Human Development Index? The Human Development Index means by virtue of the health, by virtue of the education qualification, by virtue of economy. Considering these three, health, economy and education, the different countries are ranked. There are around 189 countries, out of which we stand 129. Here it is written as 130, and recently we have come out one step ahead, that is 129th position in the Human Development Index. Still, we have a long way to go, because if you see, there are more than around 47% of the people are anemic in general population itself, and only one allopathic doctor is available for every 11,000 patients. And if you see the mortality rate, the child mortality rate is very high. The maternal mortality ratio is 130 per 1 lakh live births, and the GDP is very less. So a lot of problems are still to be addressed in India. If you see here, the health budget, how much we are allotting for the health is very less in India when compared to other countries. The neonatal mortality is more. I'm not going into the details of all these things. If you see here, 42 infant deaths per 1,000 live births are there in India, and different state-wise, how much is there, it is all mentioned in this pictorial representation. When a drug is discovered, we know how much money is spent on that. Billions of dollars are spent on that, and it is coming to the market. You know, different variety of stages it crosses. It crosses clinical trials, it crosses preclinical trials, lot of stages. Stage 1, stage 2, stage 3, lot of stages are there, and then it comes to the post-marketing surveillance stage 4. All this drug, all this which is spent, all the money, time, effort, everything spent on the drug will be only materializing only when it is used properly. We have got enough number of drugs in the market for most of the ailments, but unnecessarily taking drugs will lead to problems again to be addressed. If you see this particular slide here, it is given that the Indians have purchased medicines worth of 1,36,802 crores in last year. From October 2018 to September 2019, we have taken or consumed, in terms of value, we have consumed 1,36,802 crore worth of medicines. And out of which the antibiotics are said to be maximum, followed by the cardiac drugs and gastrointestinal drugs. Medicines, if it is not used appropriately, it becomes medicines. So always remember that drugs are the same, whether it is past or present, drugs are the same, but the patients are different. That is the new concept now. The patients are different. What I mean when I say patients are different, it is personalized. Personalized medicine is the future, right? Previously, one size fits all, whereas now one medicine doesn't fit everyone. It has to be personalized, individualized. What do you mean by personalized medicine? The other names are there: precision medicine, theranostics, stratified medicine. The medicine should be tailored according to the individual patient's requirement. That is called as personalized medicine. Especially seeing the genomic changes, the genetic changes, we check the patient's genetic changes, and accordingly we treat the genetic, that particular gene is being treated, especially in case of cancer therapy. If you see the current medicine in cancer therapy, for example, colon cancer, a drug is given and we check whether effect is there or no effect is there or any adverse effect is there. Whereas the future medicine is not like that. Once for a colon cancer, a drug is given, it is personalized. For this particular person, is there any change in the genetic modification is there? Because of that, the cancer has developed. Then identify the gene, that particular gene, and then target the gene. Right? So it is targeted medicine, that is personalized medicine. Diagnostic test is done, patient genetic content and other molecular and cellular analysis is done. So the study of this is called as pharmacogenomics, and it helps the patients to mitigate the risk and prevent the disease. The traditional medicine for cancer gives radiation, chemotherapy and surgery, whereas the advanced personalized medicine talks in pharmacogenomics. That is, any genetic sequencing is to be checked. If there is any modification in genetic sequencing which ended up in the disease or cancer, so identify that and target it, and the immunotherapy is given, and targeted therapies are the need of the hour. If you see the personalized medicine, right, say two patients are there, patient A, patient B, depending on their mutated condition in their DNA, the medicine differs and the treatment also differs. I take a classical example here, one called as Batten's disease. What is this Batten's disease? It's a neurological disorder, and this particular disease, it is reported in New England Journal of Medicine. The person, she's an 8-year-old female girl, and till 2 years of age, the neurological conditions were very good. From 2 years to 8 years, the neurological disorder had come, and they could identify the particular gene responsible for the neurological disorder, and the mutated gene identified was MFSDH. And this particular gene was targeted, and the drug was given to target only that particular specific gene, and it was treated. And the drug name is kept as Milacen. Mila is the name of the girl who got the disease, and they have kept the name Milacen, the drug name. So targeted drug therapy is a classical example which is being carried out nowadays. The genetic variation, especially DNA, RNA or protein, the genome sequencing can reveal the mutation in the DNA. So that mutation, if you can study and we can target that, then the genome-wide association study, it will look into the disease and then sequence the genome of many patients with that particular disease to look and for shared mutations in the genome. So personalized medicine is the need of the hour. So whenever you wanted to treat a person, right, personalized medicine, whether that particular problem is because of the drug or the prescription, if the drug selected is right or wrong, whether any overdose or underdose is given, whether the patient is compliant with the drug therapy or not, is there any ailment which is undertreated in the patient, whether any drug monitoring or dose monitoring is required in the patient, whether any adverse effects are there. So all these things, when you check in a patient, then the personalized medicine comes, and pharmacist plays a major role in doing all these personalized medicines. So optimizing the drug therapy, the cases collected from during ward rounds should be analyzed for potential drug-related problems. What type of drug-related problems? If you see here, the drug-related problems are identified by the pharmacist during the ward rounds, either by reviewing it or by from information system or by interviewing with the patient. Say for example, by reviewing the case record, they can know whether the dose is low or not, whether the drug choice is correct or not, is the drug contraindicated, is there no clear indication for the drug use is there, or is there any duplication of medications, or whether the dose is high, whether any drugs are not administered for a particular indication. All these things can be done only by the clinical pharmacist when they review the medication chart. Here I am giving you a classical example. For example, a patient aged 87 complaining of burning micturition and also pain while urinating. Doctors have advised for urine culture, and the urine culture had come. Doctors have diagnosed with UTI. Mostly the urine culture, more than 70% E. coli will be there. So they have given a urinary antiseptic tablet nitrofurantoin. And what is the role of pharmacist here is, the patient is a geriatric patient and we have to think of the renal function. And the GFR of this patient is 45 ml per minute. And it's a moderate kidney failure, and use of nitrofurantoin is contraindicated when the creatinine clearance is less than 60 ml. And that is how the pharmacist plays a role and indicating the doctors that this particular drug should be avoided in the patient. Another case scenario, a patient with deep vein thrombosis, a 56-year-old, complaint of right leg pain, and the patient are given warfarin, and the patient counseling is asked to be done by the physician to this particular patient. When you wanted to do patient counseling, you should know the entire therapy and also the entire medical and medication conditions of the patient. Just a small example given here, the patient should avoid or consume low quantity of vitamin K rich foods. So we have to inform the patient what type of vitamin K rich foods are there, which are the things he has to avoid. So they have to have, they should always remember that since they are taking anticoagulant, when they brush, they have to be very soft, otherwise they'll get bleedings in the gums. So small information can be given by the pharmacist alone, because pharmacist only can play this role as the medical professionals doesn't have much time to spend with the patients. There are literature that says that the maximum time spent by the physician with the patient is 3 to 5 minutes, whereas the pharmacist can spend on the bedside more time with the patient to do all these pharmaceutical care activities. So pharmacists can check the medication errors, can check IV incompatibilities, can check drug interactions, can do the cost minimization study, can check for any side effects and change the medications, and also can do the dose adjustments and also check for the reliability of the product. There is one area which is coming up nowadays that is called as biomedicine. What is this biomedicine? It is a branch of medical science that applies biological and physiological principles to clinical practice. The diagnostic tools, the drug discovery, and the new treatments are coming into play. If you see here, I'm giving few examples of the new treatment. Say for example, cardiology problems are there. There is a new biomarker called as non-coding RNA. ncRNA, non-coding RNA. So this biomarker helps for the risk stratification, diagnosis, and prognosis of the cardiac injury. And this non-coding RNA are released into the circulation, and this particular type of ncRNA, non-coding RNA, there is a type called as microRNA. In this microRNA, a special type called as microRNA 34 is identified to cause remodeling of the heart, that is, which is responsible for the cardiac problem. Once this is targeted directly, it can improve the heart functions. So directly we can check because of this new biomarker. Non-coding RNA is a new biomarker for cardiac problems. Another new thing is the stem cell therapy. We know that these stem cells, they are having two basic qualities. One is they have the ability of self-renewing and also the ability to differentiate into almost another type of cell within the body under appropriate condition. So when the stem cell therapy is given, it can produce its own cardiac myocytes. So under appropriate culture conditions, it can differentiate into multicellular structure called embroid bodies, which contain differentiated cells from all three germ layers, including cardiomyocytes. So the cardiomyocytes, the myocardial cells, can be produced from the stem cells. So stem cell therapy is again a new one. Another is sirtuin 3. What is the sirtuin 3? It is nothing but a mitochondrial NAD-dependent deacetylase enzyme. It regulates or protects the cardiomyocytes from oxidative stress-mediated cell damage. Once this is there in the body, then the heart is protected. So here, there are a lot of target areas or the gene where it is identified, and this particular chemical, this SART3, is involved in a lot of mechanisms like urea cycle, TCA cycle, glycolysis, right? A lot of areas in energy metabolism, in oxidative stress and apoptosis, these are involved. If the amount of this SART3, sirtuin 3, is reduced in the body, then it can cause cardiac hypertrophy. So once it is increased in the body, the heart can regain to the normal. So all these studies are newer. Even for COVID, very new identification test is approved for the commercial launch. Its name is Feluda. It is developed by Delhi-based CSIR Institute of Genomics. Like pregnancy testing, CAR testing, here, with the help of blood or saliva is said to be more preferred. Just it has got 96% sensitivity and 98% specificity. And the cost-wise also it is very less, and the time taken is also very less. Here the kit takes only 45 minutes to give the results, whereas the RT-PCR test takes around 2 hours, whereas the rapid antigen test takes around 30 to 40 minutes. Here it is similar to the pregnancy test, but it is not protein-based, but it is nucleic acid-based test. So a lot of new inventions, new things are coming into play, right? But what we have to keep in mind is the inter-subject variability. Each and every subject is different. That is what I said in the beginning. Personalized medicine, individualized therapy is required, where the pharmacist plays a major role. So genetics, diseases, age, body weight, drug interaction, it differs with the individual. For example, if renal failure patient is there, then the insulin, allopurinol, antiviral drugs and metformin doses have to be reduced because the elimination through kidney is reduced. All these drugs should be reduced. There are a lot of drugs which require dosage adjustment, especially the diuretics and cardiac drugs like digoxin and beta blockers, right? Drugs for gout, opioids, hypoglycemic agents. All these drugs require dose adjustment whenever there is renal compromised patients are there. Another important thing is some of the pharmacokinetic parameters like extraction ratio. You know that the physicians are not bothered about all these things, whereas the pharmacists, they study all the bioavailability, bioequivalence, pharmacokinetics parameter of a drug. If you see the extraction ratio, it is used to calculate the renal plasma flow to evaluate the renal function. It is the amount of compound entering the kidney that got excreted into the final urine. You should know when such drugs like NSAIDs, diazepam, all these drugs are used, they have got very low extraction ratio and high extraction ratio like chlorpromazine, levodopa, propranolol, etc. So extraction ratio, information about the extraction ratio helps the renal blood flow to be improved or reduced. Another again, hepatic blood flow. If the blood flow to liver is less, then the first pass metabolism is less and there is increased bioavailability of the compound. If some people who are having impaired hepatic function, we have to be very, very careful, especially the bioavailability of morphine and labetalol is doubled if there is decreased hepatic blood flow. Similarly, when the protein binding is impaired or decreased, say for example albumin, all of us know this, most of the drugs combine with albumin, acidic drugs combine with albumin, and basic drugs combine with alpha glycoprotein in the body. So altered volume of distribution, decreased protein binding, it causes increased toxicity of the drugs. Most of the times, the clinicians takes the decision of choosing the drug with the help of the lab values. So the clinical decision making is done, 70% of the clinical decision making is done based on the lab results. But if the lab results are not proper, not correct, there are two terminologies which we have to understand. One is false positive and false negative. The false positive is an error in data reporting in which a test results incorrectly indicates the presence of a condition. The condition is not there, but it indicates, say for example, it indicates hyperuricemia, gout, but actually the patient may not have gout. Another indication is false negative, is the opposite error. The test sees to be correct, whereas the results incorrectly fails to indicate the presence of the condition when actually the condition is present. So drug-related laboratory test inferences is again a very good informative thing where the pharmacists have to play a major role. For example, if you take a patient is taking glucocorticoids. So these glucocorticoids, long-term use of glucocorticoids can lead to diabetes. Not only glucocorticoids, even antibiotics, some fluoroquinolone antibiotics, when long-term use, it can cause diabetes. Right? So long-term use of statins can cause diabetes. So whenever these type of drugs are taken, we have to check the patient's glucose level. When you check the patient glucose level, sometimes false glucose positives can happen. I've given here a few examples. Say for example, if you see this albuterol is nothing but salbutamol. Albuterol causes falsely high glucose readings. Similarly, the fluoroquinolones and cephalosporin antibiotics, when the patient is on these antibiotics and check the sugar level, it will show the altered plasma sugar level. Similarly, when amiodarone is used, it increases the prothrombin time and INR. So whenever there is just increase in INR, we should not immediately go for the treatment. We have to check what sort of drugs are being taken by the patient, and accordingly, either by avoiding such type of drugs, these terminologies can be brought down. Biotin is one of the vitamin that is called as vitamin B7, and this biotin interferes with maximum test. Say for example, if a patient is going and testing for TSH level or thyroid function, this biotin interferes the thyroid level. It gives high values of all these levels. Similarly, biotin results falsely low levels of insulin. It gives lower levels of insulin, B12, vitamin D. So biotin interference should be avoided. Similarly, biotin causes false low results in thyroid stimulating hormone, FSH and all. So biotin is again good, but this vitamin interferes with most of the lab values. The pharmacist should also know which are all the drugs when it is seen in the prescription, we have to alarm. We have to give alarming signal. Say for example, fluoroquinolone, levofloxacin with NSAIDs, diclofenac, it can cause epilepsy. The fluoroquinolone itself can cause epilepsy if it is not used properly. Nowadays, you would have seen there was a report that the norfloxacin can cause aorta damage, rupture of aorta. Aorta is the largest artery in the body. When the largest artery ruptures, the perfusion pressure, the blood supply to most of the organs will get reduced and the organ damage can happen. So levofloxacin should never be combined with NSAIDs. If at all it is there in the prescription, it should be spaced out and taken. Similarly, clopidogrel and rabiprazole, high risk of stroke is reported. More than 40% of the cases reported stroke. So this combination is a deadly combination. It is a major adverse effects can happen. So if these combinations are there, it should be spaced out and given. Similarly, nitrofurantoin, it's a urinary antiseptic. Most of the urinary tract infection, this nitrofurantoin is given along with citralca, which is systemic alkalinizer. But both of them should not be taken together because nitrofurantoin works only in the acidic medium. Only in the acidic medium they are in unionized form, and only in the unionized form the pharmacological activity is there. Citralca is alkalizing agent, and the citralca in the medium, citralca potassium citrate medium, this nitrofurantoin will not act. Again, another important thing is the deadly combination is insulin with pioglitazone. Insulin should never given along with pioglitazone. It can end up in congestive cardiac failure for the patient. Another area where the pharmacist can play a major role is antibiotics. See, throughout the world, if you see, the maximum number of drugs category used are antibiotics. In 1928, Alexander Fleming discovered this antibiotic penicillin, and in 1945, he was awarded with Nobel Prize. And during that speech, acceptance speech, he has warned the danger of antibiotic resistance that time itself. Methicillin-resistant bacteria are found in 1959, and if you see, the World Health Organization started giving alarm about this awareness since 2015. If you see this slide, this indicates the discovery of the antibiotics and the development of resistance. Penicillin discovered in 1928, resistance identified in 1940 itself. Similarly, this tetracycline 1948, in 1953 itself resistance. If you see macrolides in 1985 itself resistance. Fluoroquinolones, carbapenem group of antibiotics, 1985 it was discovered, and in 1993 itself they have produced resistance. On an average, it is said that the microorganisms produce resistance to antibiotics within 8 years from the introduction of the antibiotics. When an antibiotic is introduced into the market, within 8 years of span of time, the microorganisms have developed resistance. How they develop resistance? A little knowledge about how they develop resistance. See, they inherited generation to generation, they take the resistant triads. That means they can also pass directly from germ to germ by the way of mobile genetic elements. There are three mobile genetic elements. One is called as plasmids, another is transpoons and phages. The plasmids are the circles of DNA that can move between the cells, and transpoons are the small pieces of DNA that can go into and change the overall DNA of a cell. These can move from chromosomes, which carry all the genes essentially into germ survival, to plasmids, and the viruses that attack the germs can carry DNA from germ to germ. So mobile genetic changes can happen, and due to three steps are there: transduction, conjugation, and transformation. This can cause change in the genetic material. I'd like to quote an example here. In Lancet Infectious Diseases Journal, it is mentioned that there is a new gene identified called as MCR1 for colistin resistant patient. In colistin resistant, there is one gene in bacteria. There is a bacteria which mutated and formed a mutated gene, and this particular gene, till date, people were not able to combat or bring down this particular disease. Colistin resistant. This colistin is used in agricultural field, plowing fields in China. Tons and tons of colistin is used, and whatever the plantations, everything contains colistin, and whenever consumed by the cattle or by the human being, the colistin enters into the body. The colistin polymyxin group of antibiotic, it enters into the body, and ultimately colistin is there in the body, so that this particular mutated gene will not respond to colistin antibiotics. So colistin is the last resort antibiotic for urinary tract infection. Even a study conducted by the Christian Medical College, Vellore, and also Apollo Cancer Hospital, Chennai, in 22 different locations, they have taken the sample, and even they found that even the salad and the apple, they have got the colistin resistant strains. So it is very important, antibiotic awareness. I told you, since 2015, WHO has taken a very good lead in this antibiotic awareness. This year also, from 18th to 24th November, Antibiotic Awareness Week. The present Director General of World Health Organization, Tedros, he has told very clearly that there is no commodity in the world more precious than health. The World Health Organization conducted a survey about antibiotic resistance. What is the opinion of, what is the role and what is the opinion of the patients? The patients, most of the patients said that 76% of the respondents said that Resistance means my body is resisting to antibiotics. They doesn't even know that the bacteria is resisting the antibiotics, not our body. They think that our body is resistant to antibiotics. So the clinical significance of antibiotic resistance is if the resistance develop, therapeutic failures can happen. Hospital have to go into higher antibiotics, that is called as antibiotic pressure. They need to use more costly and toxic agents, and unnecessarily the emergence of untreatable pathogens can come. So that is why the government has come out with a schedule called as Schedule H1. Schedule H, all of us know, that is prescription drugs. What is Schedule H1? This Schedule H1 drugs, there are 46 drugs are there in Schedule H1. And these drugs, when it is prescribed by the doctor, it has to be given as it is. For example, if the doctor gives for 5 days, the pharmacist have to dispense it only for 5 days. It should not be dispensed for 1 day or 2 days, even though the patient asks for it. Out of these 46 drugs, 32 drugs are antibiotics. And all the anti-tubercular drugs are included in this list of antibiotics. There are a lot of evidence which says that pharmacist intervention in improving the compliance of antibiotic prescription, it improved the quality of life in patients who are taking antibiotics. Even our government in 2016, they have come out with a national treatment guideline for antibiotic microbial use. It is a 64-page document. Each and every pharmacist should have it in hand. In that, it has written very clearly what category of antibiotics should be prescribed as first-line drug for what disorder, what infections, and if it is not working, what is the second drug of choice. Everything is given in the form of tabular column in this national treatment guidelines, which was published by the National Center for Disease Control. There are a lot of newer antibiotics launched. It is our duty, it is the duty of the pharmacist to inform the doctors that even though the new antibiotics are there, it has to be handled with care. It has to be prescribed only when it is required. So a lot of newer antibiotics, I'm not going into detail. Omadacycline, the major advantage of this is even for resistant bacteria, it is helpful. Again, eravacycline, again it's an antibiotic for complicated intra-abdominal infections, right? It is also useful against most resistant pathogens. Lefamulin, again antibiotic, which is available both as injection and tablet. It is for community-acquired bacterial pneumonia. The major advantage is it has got both oral and IV dosing flexibility. Another salicylate, another antibiotic, right? The newer antibiotics, right? It is available in different formulations, right? Dosage forms, and 60 milligram, 100 milligram, and 150 milligram. It is again for the treatment of acne vulgaris, right? So it almost have clear skin comes within 12 weeks of treatment. Another cefiderocol, right? It is for complicated urinary tract infection in adults. It is given as 2 grams IV every 8th hourly over 3 hours. So major advantage is 73% of the patients had resolution of complicated urea when compared to even the carbapenem group of antibiotics. More than carbapenem group of antibiotics, this particular drug, cefiderocol, is very much useful. Not only antibiotics, there are a lot of drugs which are being invented, which are coming to the market. Pharmacists should have constant update of knowledge regarding the newer drugs. Diazepam has come as nasal spray. Then the SGLT2 inhibitors, that is empagliflozin, and the dipeptidyl peptidase 4 inhibitor, linagliptin, and metformin. These 3 drug fixed dose combination is approved in January 2020. Similarly, drugs like celecoxib are coming as oral solutions, which is approved in May 2020. Metoclopramide nasal spray is available, which is approved in June 2020. So why I'm saying all these few examples I've taken, because pharmacists should be able to convey to the healthcare professionals, especially the doctors, regarding the new arrivals and their advantages and disadvantages. Because the company people, the medical representatives, are going to talk only about the positives of their product, not the negatives of it. If you see ambulatory care pharmacists, in abroad countries, different category of pharmacists are there. Ambulatory care pharmacist, cardiac pharmacist, pediatric pharmacist, oncology pharmacist, different category of pharmacists. They are specialized in that particular area. So they are giving a lot of information about the drug, They manage the chronic diseases. There is one called MTM, that is medication therapy management, is taken care of by them. Even they are included or involved in immunization screening programs, and they also participate in physician quality reporting systems and patient education and counseling. So ambulatory care pharmacists do a lot of good work. Here I've given an example. I'm not going through it fully. Just a 73-year-old male patient. He is having is identified to have constitutive ischemic heart disease, and the doctor has given flavidon, that is trimetazidine. This trimetazidine is actually contraindicated for elderly patient, and the pharmacist intervention had made to inform the doctor that decreased creatinine clearance is there, and the ideal dose for this is 35 milligram per orally, and it has to be reduced. The dose reduction is there, and if it is contraindicated for the patient, that also has to be informed to the doctors. Dose adjustment is again one of the major work by the pharmacist. Most of the times, the other healthcare professionals are not aware of this dose adjustment. So we have studied whenever the creatinine clearance is less, whenever the hepatic problems are there, whenever the patient has got high protein bound capacity. So what sort of dose adjustment should be done, right? Which formula has to be used, right? So all those things have to be taken care of. Whatever you studied should be implemented when you are there working in the clinic side. Again, pediatric pharmacy is one specialized pharmacy services in abroad countries, right? Nowadays, slowly it is penetrating into India also. So they have specialized in adult medicine, even though whatever adult medicine is given, the same adult medicine, if you wanted to give it to pediatrics, especially in oncology, transplantation, and neurology, what sort of precautions to be taken. So these pediatric pharmacists will have sound knowledge on the concepts of the medicines management across the whole range of ages, from birth to the childhood age. Here I have given one example. Again, it is all available on the internet. You can go through it, WHO websites, it is all there. So here a patient, a 2-year-old male child, was receiving the drug flecainide for arrhythmias. The type of arrhythmias, that is junctional reciprocating tachycardia, was there, and he was also receiving nadolol. The problem happened was suddenly one day the male child was having bradycardia, severe bradycardia, decreased heart rate was there. And when it was identified the reason, there was syringe reversal. The syringe in which this particular flecainide has to be taken, it was taken 5 times more, and the medication error was identified by the pharmacist and reported. So a lot of things the pharmacist can do. Here are a few examples. A clinical pharmacist in the pediatric setting. It is a study conducted in the year 2019, right? They emphasize the importance of pharmacists in pediatric setting. So those who are interested, you can go into this study. You can go through more what sort of errors, how the prescriptions are recommended prescriptions after understanding the error. There are some newer tools that aid this pharmacist intervention, right? So I'll tell you, there is one thing called as medication regimen complexity index. What is this medication regimen complexity index? It is a newer tool that can aid the pharmacist intervention. So they have to find out this MRCA. How to find out this? There are 3 criteria. One is what sort of dosage form is given to the patient. Whether it is oral dosage form, if it is oral, then what sort of, either it is a tablet, capsule, liquids, powders, granules, sublingual, what type of oral formulation. Similarly, if it is topical, what type of formulation. So dosage form and dosing frequency, at what intervals it is given. And is there any special instructions, whether it has to be crushed and taken or not, or it has to be taken or avoided with particular food substances, all these instructions. So all this dosage form, dosing frequency, special instructions, all together, it gives this MRCA, that is medication regimen complexity index. So this medication regimen complexity index helps the pharmacist to calculate the complexity of the medication regimen prescribed so that necessary interventions can be made. Nowadays, there are a lot of technological advancements which helps in pharmacy. I'm going to talk in few slides what are the technological advancements in pharmacy which has come into play. Say for example, current impact of mobile. The cost reduction of 55% of hospital side reduced cost of patient care. The quality improvement is said to have 72% of the hospitals highlight the improvement in quality of patient care. Right, 77% of the patients felt positive about clinicians using mobile device in their care. The remote patient monitoring is possible, especially in the COVID conditions. The telehealth is very satisfactorily the patient had given their outcomes. Artificial intelligence plays a major role in the mobile technology. I've taken few examples. The advances in healthcare with the use of smartphones. The smartphones with advanced sensors and powerful processors can take measurements, track movement, and also that they track the movement and record informations are being used by the researchers. So digital platform, they help to record, especially precisely the symptoms, the biomarkers, right? Especially in neurological conditions where the endpoint cannot be established properly. These digital monitoring is very much useful. There is one called as 3D printing. This 3D printing is again helpful in dose individualization for the particular patient. Suppose if the patient is having heart problem, you can give the particular dose for the particular patient, and the tablet can be made designed in such a way that it is like a heart. Even for liver problem, you can design as a liver. You can, as a stomach problem, you can design it as a stomach. So 3D printing, it allows, even though it allows more higher dose delivery, at the same time, it gives a bioprinting of the tissues and organs, right? Suppose for kidney problem he's taking, he can be given the tablet in kidney shape itself. So a lot of things are coming into play. 3D printing, individualized tablets or individualized medications can be given. Nanotechnology, as we all know, it's a microscopic technology, ranges from 1 to 100 nanometers, right? They can easily travel into the human bloodstream. They, especially in the anti-cancer drug targeting therapy, this nanotechnology is very much useful to reduce the toxicity. There is another called as nanobots. They are used very effectively for drug delivery. In fact, it can be consumed by the patient in the form of pills or injections, right? The drugs can be targeted to the precise location, and they are introduced into the body to repair and detect the damage at a particular point of place. And the diagnosis, prevention, and treatment through drug delivery, like glucose monitoring in diabetes patients, ameliorating heart attacks, tissue reconstruction, nerve regeneration, cancer therapy, brain target drug delivery, bone targeted drug delivery. So targeted drug delivery systems have got these nanobots. Another synthetic 3D tumors are there. You can, instead of checking the real tumors, the artificial tumors are made, and this synthetic 3D tumors, they provide a better look at how tumors behave when the drug is given to them. So because of artificial intelligence, there are different types of 3D tumors are made, and the similar cell surface markers are tested on them. The targeting tumor microenvironment, the environment in which the tumor cells grow, such type of environment is developed synthetically, and the drugs are tested. Again, the simulation models are there. You need not use any animal model or human models. A lot of simulation models have come now for drug testing process. The wireless brain sensors have come. See, it is again the advancement in technology. It allows the doctors to create biosorbable. That means it will get absorbed. Whenever your work is over, it will get absorbed itself, right? When it is placed in the brain, and they can easily dissolve and when they are not required. Again, the electronic health record is very much useful. It helps to serve the customers on the patient care. It helps to know the history of the patient, the current status of the patient, to improve the patient quality of life. So e-verification systems, nowadays most of the hospitals, they are giving barcoded, the patient, they are giving a barcoding, and everything is linked to that. Whatever lab values, whatever informations recording pertaining to that particular patient, everything is recorded in that barcoded system. It is all digitalized. Adherence monitoring, again the patient, whether he's taking the medication or not, every time you cannot go and see there at home. So adherence monitoring softwares, adherence monitoring strips are there, smart packaging are being developed, and some microchip containing the tablet blister pack. Once they open and take, there will be a message sent to the either to the pharmacist or to the doctors. And there is one called a smart pill. Nowadays they are making it. Still, it is not there in the market. It is there in the trial run. What do they do is it consists of a sensor pill. It is taken by the patient. It transmits the data on doses taken, heart rate, body posture to the mobile telephone or tablet device of the healthcare professional. All the informations regarding your body parameters, lab parameters, everything will be sent automatically to the doctor's mobile. Automated dispensing is also being happening. All of us know that robots are used for automatic dispensing. The automated methadone dispensing machines are becoming very famous in abroad. Directly they can go, they can feed the prescription and they can take the drug from the automatic dispensing machines. One important thing is telemedicine. This telemedicine concept has come in 1970s. It means that healing at a distance. According to World Health Organization, the delivery of healthcare services where distance is a critical factor by all healthcare professionals using the information and communication technology. It is nothing but the telemedicine. See, in telemedicine, if you see, it is very much essential for India, especially in the COVID situations, right? Because as per the World Health Organization, for every 1,000 people, one doctor should be available. And in India, it is for every 1,139 people, one government doctor is available. Right? So we have got shortage of hospital beds, and in fact, the telemedicine market in India is expected to grow with a volume of $5.4 billion by 2025, with a compound annual growth rate of 31%. So the future is going to be there for telemedicine, and the government had come out with a guideline, strict guidelines for telemedicine. It is published in the link mohfw.government.in. These guidelines are issued to bridge the gap between the existing norms. So, role of pharmacist in telemedicine, very well it is there in North India. A lot of places they started using it, and the feedbacks have come very nicely. GeoMitra e-clinic, right? So they have come out with an app called as GeoLife app, and it is also instructed to the health ministry that the PharmD professionals are qualified to provide this ambulatory care, and currently the concern is working on incorporating the pharmacists into the process of telemedicine. So when you pharmacists have to be there in all this process, you have to use your heart and mind. There should be a balance. You should strike a balance between your heart and the mind when you wanted to do the service. And the success rate depends on the knowledge, practice, skill, and the attitude. Right. And thank you so much for the patient listening. Let us all work together for effective patient care. Thank you. Thank you so much.
Thank you very much, sir. You have given a most valuable and informative session on antibiotic use, pediatric pharmacy, newer antibiotics, and telemedicine. Thank you very much, sir. With your kind permission, shall we move on to the question session, sir?
Yes. Yeah. Is it okay
Sir.
now?
Yes, sir. Here is the first question. Are there any
Yes.
apps to calculate doses in renal impairment?
Yeah, even in micromedics, it is all there. See, in internet, a lot of things are available, but not like an application, not like apps. You can go and give the values, and it itself will give you the creatinine clearance, and it calculates through Cockroach-Gold equation or DMRD equation. A lot of equations are there. Once you give the values, it gives the answers.
Thank you, sir. Here is next question. Can we give all the pharmacy practice services like telemedicine, patient counseling, and prescription auditing in a retail pharmacy established by us?
Yeah, very well, it can be given. If you see the pharmacy practice guidelines, right, 2015, if you go and read, it is clearly mentioned that what are the services which can be given by community pharmacists, where patient counseling is there, BP monitoring is there, glucose checking is there. So all these are also a part of health screening services, which is approved. Again, it is gazetted in the pharmacy practice guideline. I request everyone to go through the pharmacy practice guidelines.
Thank you, sir. Sir, here is one more question. Is it legal to do telemedicine in a retail pharmacy in India?
Again, I have told you in my presentation, still the pharmacists are not included legally, but works are going on, right? Recommendations are being kept by various several organizations to the government, and soon it is going to be there. Because there are few places in North India that is being tested, and the pharmacist role is very well recognized there. Because more than next to the doctors, I can say more than any other professionals, right? Pharmacists know more about the drugs, and they can talk more about their adverse effects and side effects or any interactions. They are the highly professionalized, professional candidates who can talk more about the drugs, because we know from the starting, from the crude drug or from the active pharmaceutical ingredient API till it reaches as a formulation. The pharmacist studies a lot, and he is being given more training in the hospital, especially the PharmD graduates. So very well, they are suitable for telemedicine conversation.
Thank you, sir. Here is one more question. Appreciated if the extraction ratio with respect to hepatic and its role in pharmacy practice.
See, always remember that there are few gray areas where the doctors cannot come and work. When I say gray areas, when you go and talk to your doctor regarding half-life of the drug, regarding the volume of distribution, regarding this extraction ratio, regarding dose adjustment, regarding perfusion pressure of blood into a particular organ, all these things they will not keep in memory, they cannot, right? Whereas these are the gray areas where the pharmacist can work upon. You can check the liver function of the patient, and you can also go for the bioavailability of the drug if it is required, the plasma samples, right? Lot of information, lot of gray areas where the doctors cannot work, you can do it. The clinical pharmacist can do that, especially when there is toxicity monitoring services.
Thank you very much, sir, for your valuable and informative session. Now I request convener of today's program, Dr. D. Ranganaikulu, sir, to address the session and present certificate of appreciation.
So I think Sarah has to unmute. Sir, you have to unmute and talk.
Is it
Sir,
okay?
please unmute and talk, sir. Yes, sir.
Rashmi?
Now it is.
Yeah. Thank you, Professor Sriram sir. You are given this kind of narration on the transformation of global healthcare and the pharmacist patronization and everything. In fact, you had given it is like ocean-like subject where we can endless. We can talk more than 3 to 4 days. Like this is program is like that. So there is no end point, but I had given very key point how to share our responsibility being as a pharmacist. Looking at the first line, drugs to up to digitalized and automated and telecommunication drugs concepts also. Of course, it's very good. But meanwhile, you are given such kind of enlightenment and a very awareness for the pharmacist, young pharmacist and clinical pharmacist regarding this. Factors affecting on the drug action. That's very, very important. Looking at the pathology factors. So, what are the drug-related disorders and everything? That's very important. What I felt to lead the health protection and know to lead the healthcare system in between the physician and toward the pharmacist. It's a very, very valid one. Looking at the ADR and comorbidity factors and all drug-related depends on the genetic also, gender also. And it depends on the age factors, infants and geriatrics also. So given a very good suitable example where you have to be ensure the safety margin of drugs being as a clinical pharmacist. So with this updation of knowledge, by having this kind of regular updation of knowledge and wisdom, global wise, we can meet out the demands of healthcare productions, and we can do a better service for the healthcare community as a vital role of the pharmacist. I believe in that. So I hope all my students community, all my teacher community has been inspired and they noted some kind of corrections in the practice. Definitely we do our service for the community's sake for the safety margin. Thank you very much, sir. In spite of all your busy schedule, with the interest of academic no interest, you have accepted our invitation all the way. We are on the digital platform. We are here to have an interaction. Thank you very much on behalf of my management and the students committee and pharmacy practice.
Always happy to be associated for any professional resource. Thank you, sir.
Thank you. I trust you. This same tempo is going to be continued. The
Thank you, sir.
first next.
Thank you, sir. Thank you very much for inviting. Thank you very much for all your work. Thank you.
Yeah, it is now a token of respect. I request Professor Sriram sir to accept our token of appreciation on this regard. Thank you very much, sir. Thank you very much.
Thank you. Thank you, sir. Thank you very much. Thank you so much.
Next, over to studio.
Sri
inspection.
Thank you, Lakshmi madam. Good afternoon, everyone. I am Dhananjaya, faculty in the Department of Pharmacology. Indeed, it's my privilege to propose on this webinar, which is conducted by Pharmacy Practice Department. And firstly, I thank our honorable speaker, Dr. S. Sriram sir, for delivering excellent presentation on the topic transforming healthcare, partnering with the pharmacist. It was very insightful and enlightening. That has covered almost all the aspects of pharmacy practice where a pharmacist can fit in and serve and support the healthcare system. Thank you very much, sir, for spending your valuable time with us, for enlightening us. And I extend my sincere thanks to our chairperson, madam, Srimati Sulochana Garu, and the director, sir, P. Pranit, sir, and for their encouraging us and allowing us to conduct such kind of webinars in this COVID-19 pandemic situation. And I extend my sincere thanks to our beloved principal, sir, and convener of this webinar, and also our Director of Academics and Planning, Dr. C. Sridhar, sir, for their persistent encouragement and support to update the students community with the extra knowledge along with the academics. Thank you very much, sir. And I thank all the organizing committee, particularly the organizing secretary, supported Mr. Dr. V. Shanmugam, sir, and the coordinator P. Lakshmi, madam, and P. Sai Sunil, and all the other webinar committee who has shown their commitment and cooperation throughout the completion of this webinar. And thank you very much. And I extend my thanks to all the participants, the student community who have shown their trust to obtain the knowledge, that extra knowledge, right, during this COVID-19 pandemic. Thank you one and all.
Thank you all the participants. Thank you all the.
Thank you, sir.
Thank you, sir. Thank you.
Rajesh, name the man. Rajesh?
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Looking at the COVID condition, it is feasible to conduct this.
దాంట్లో ఊరికే పెట్టినాం ఫస్ట్ ఇయర్కి 2 మిడ్ ఎగ్జామ్ కండక్ట్ చేయాలి దానికి
Thank you all. Thank you everyone for your active participation. Thank you all for participating in this webinar.